Let me ask you something. Are you a good listener? Most of us think, yeah, I'm a good listener. But listening goes beyond hearing words. It's about understanding and connecting and responding with empathy. And in healthcare, being a good listener is one of the most powerful tools you will have. And some of you may be sitting here saying, Tiffany, I'm not the nurse, I'm not the provider, but we all are part of this care team, and we all need to practice good listening and hearing what patients have to say, and hearing, importantly, what our coworkers have to say and the people around us. We can all benefit from practicing good listening skills. So bear with me as we go through this. Let's imagine for a moment that there's a patient and they feel unheard, they are feeling rushed through their appointment, they feel like they're being brushed aside. How do you think they feel? They probably are frustrated, anxious, thinking, I don't ever want to come back to see this office again. They may feel neglected. Now imagine the patient that goes into an office and the registration clerk listens to them and looks at them while they're getting their information. The provider or the nurse that leans in and wants to know more about what they're saying. They're genuinely listening and hearing their concerns. That moment of connection builds trust. It reassures the patient and improves their overall experience. Good listening isn't just about being kind. It impacts the quality of care we provide. When we actively listen to what the patient is saying, we are gathering crucial information, whether that information is about their health, about their insurance, about their billing, about their room, things that they may need or desire, about their food services. We are constantly gathering information. We all have an opportunity and a role in listening to patients. But when we gather this information, we can catch concerns that might otherwise be missed. And when we gather this information, we can improve outcomes in their care, especially the nurses and providers and CMAs and techs. All of you are constantly gathering information that the patient is sharing with you, and then you can reiterate that to the provider or the nurse in charge, and that can improve the quality of care we provide in a great way. And so when people start to tell you stuff, ask them to tell you more, to share more. So how can we be better listeners? Be present in the situation. Quit typing on your keyboard while somebody is giving you information. Don't look at your phone. Don't look away. Put away those distractions. Maintain eye contact. Show engagement, whether it's nodding with your head, agreeing. Secondly, listen to understand, not just to think of how you're going to respond in this situation, but truly understand what they're telling you. Patients don't need just answers. They need to feel heard and understood, and that you're listening to what they have to say, because they are part of their care and their care team. And third, reflect and clarify. Repeat back key points that they have told you. Confirm that you understand what they are saying. Say something back. So I heard you say, or make sure I understood this clearly. And that's a way to make them feel respected and valued. So I'm going to ask you again, are you a good listener? And how can you improve in your listening? I hope I've given you some tips. Being a good listener transforms the patient experience, and we can all get better at it. So put your listening ears on and have a great day.